I'm Bennett McIntyre with the St. Peter's Health Foundation, and I'm the project manager. So this is our 26th annual Light of Life event benefiting St. Peter's Hospice. It's the only fundraiser that we do for hospice care at St. Peter's Health, which is also the only nonprofit hospice in the Helena area. Hospice care is provided by staff members of the hospital and a lot of volunteer workers that help us all throughout the year, and especially with these special events. Everybody can get hospice, whether they can afford it or not. We serve about 200 families a year at St. Peter's Health, and the money raised from this event goes to a myriad of things, such as buying supplies, special education, and just whatever folks need to get that special service. So far we've had 820 people donate to this specific campaign, and we've raised close to $70,000. In the last 26 years, we're just over $1.3 million. And people need hospice care 24/7, 365 days a year. So this is really a big deal, and we're so fortunate to see the whole community of Helena participate in something like this. Every year we have a spokesperson for Light of Life, and they have had someone in their family, generally fairly recently, go through hospice care, and it's a very emotional time for those families. So it's neat for us to be able to connect with someone in the community who can then share their story and help others who may have already gone through this or might be going through this in the future.
I returned from a trip on a late flight, and Mother was significantly different than I had expected. I asked the facility nurse to call hospice, and when Mickey answered the phone, I said, "Please come." Although it was middle of the night and snowy and cold, she came right away. And when she walked in that room, I was so relieved. I knew she would know what to do. She assessed Mother, communicated with the physician, obtained some medication. Mother rested, and I stayed the night with her. I knew now there was not going to be another rally. Hospice volunteers came in the morning and afternoon for 2 weeks. My dear friends stayed at night. I was able to go to work every day. My mother was Irish, and around St. Patty's Day, I asked the hospice volunteer to help me decorate and set up my mother's room for a wake. We had ginger ale and pear candy. My friends came, and I told them, "We're having a party for you that you're going to heaven soon." Then my youngest sister came for the final vigil. My mother was a wise and determined woman. When we were children and complained about someone not being perfect, she had a standard reply: "You don't want anyone to be perfect. When you're perfect, you go to heaven." My sister and I were at Mother's bedside, and my sister told me my mother's time was coming. I texted my siblings, and my brother texted me back. "Tell her Rob says she is perfect." I leaned down and spoke in her ear and said, "Rob says you are perfect." By the time I stood up, she had gone to heaven. My mother's final days were comfortable and calm, and I am thankful that St. Peter's Hospice was part of our journey.
I'm Mary Runkle. I'm a registered nurse at St. Peter's Health, and I've been a nurse for 4 decades, and I'm this year's featured speaker. Well, I've been a registered nurse for 43 years, and I worked in Lewis and Clark County for 42 years, and I actually worked twice for Hospice of St. Peter's. However, it's different being the daughter than being the nurse. And the important part was the amount of support that I got, both from the staff that was available on call 24/7 and the volunteers. It was a huge support to me and to my family. With hospice, there's criteria that you have to meet to have a physician order hospice, and ordering hospice is you have a terminal condition like less than 6 months. And the first time my mother was in a skilled facility, she'd been taken care of at home by my dad for about 10 years. And so her home then was in a skilled facility. And she met the criteria. She had dementia, and she thrived. she did really well on hospice. And so she graduated. So then the next time she was on hospice, one of the things that hospice did was Beverly Magley was a volunteer that sang, and my mother loved music. And so she would sing with my mother in harmony, and it was lovely. And then mother got better, and she graduated again from hospice. And then the third time, this was all over a course of 7 years. And so the third time then, when hospice helped us out, the nurses came when I called. The nurses came when the facility called. We had volunteers. I had volunteers for 2 weeks so that I could work. And the amount of support you get, even if you know things as a nurse, you need someone else to tell you, this is what it is. You can guess and you can think, but you're not sure because it's your mother. And so you don't have the same level of objectivity, and even though you try. And then the other part that's so important is afterwards, there's the support from hospice that you can either have bereavement, there's mailings, there's notices, there's all those kinds of things that if you're the daughter, it's different than being the nurse. It means a great deal to always remember the people that we've shared love with in our life. And the Christmas season, there's not a lot of ways to remember those who've gone before us with warmth and celebration. This is a celebration. And whenever I walk outside and they turn the lights on, it's like, this is the beginning of Christmas. And it's a chance for all of us in the community to read the names and remember that all these people were loved and cherished, and they're still remembered.